Next most common virus is the mumps virus. From the mumps vaccine that's now given to kids. Mumps in the old days was known to cause, first of all, the swelling of the parotid gland, but also pancreatitis and orchitis. That means inflammation of the testicles. And so the mumps virus has a preference to live in the saliva glands, to live in the pancreas, to live in the testicles, causing problems in those areas. And often the clinical symptoms will tip us off. If a child cannot digest its food, very often it's a lack of normal saliva predigestion happening in the mouth. And so we're looking for digestive problems, and it often gives that away. Then the third group of viruses are the herpes viruses. Amongst those, varicella zoster, the chickenpox virus, is the most common one that we find alive and well in these children. Very often be very active in the brain. Also herpes type 1, it's the one usually causing the blister on the lips. Very often active in the brain. Herpes type 6, which is a man-made US lab-produced virus, which is very, very common in these children, causing fatigue. So if the fatigue component is strong, I look for Giardia and I look for herpes type 6. All the other herpes viruses, Epstein-Barr, cytomegalomy, and so forth, herpes type 8, they're all important, but they're maybe less important. So this was component number 3, is the toxic effect of the infections in these kids. And the toxic effects or the infections can very well be secondary to the heavy metal toxicity. If you bioaccumulate heavy metals in those areas in the body, the immune system cannot effectively work. And it's those areas where the viruses grow and where bacterial infections set up the housekeeping. So the heavy metal toxicity may very well be at the underlying cause of this in some kids, or it may be that the infections are a primary cause on its own. You get a tick bite, or your mom has Lyme disease, you're pregnant with a mom with Lyme disease, you're out of luck. You don't need to have the heavy metals to then get the spirochetes on board that then create neurotoxins that make you just have the same symptoms as if you were mercury toxic. And the wonderful thing is that the same agents that detox you from mercury also detox some of the Lyme toxins at least. And so it was misunderstood by me and many others that if you give a mercury detox agent like DMPS and the patient gets well, that therefore the diagnosis was mercury toxicity. And guess what? It was wrong. Because there is no such thing as a mercury detox agent. These detox agents are very broad. And they get mercury out, but they also get copper out, and they get manganese out, and they get lead out, and they get Lyme disease toxins out, and mold toxins out. So just simply from giving a detox agent and the patient getting well, that you then assume, therefore it was mercury, is too superficial, too flat.
So to be a little more specific, the assumption that all the kids that recovered doing the TD-DMPS, the underlying cause was mercury, in your estimation, is not a good assumption.
No.
Okay.
No, because it's like I said in the very beginning of the statement, there's a cumulative effect of all the neurotoxins, and you cannot distinguish from the symptoms of the patient what neurotoxins it was, because they all look the same.
Or the abatement of the symptoms either.
And the abatement is the same. So this is a mistake that's currently prevalent in the field. And so I just want to guard against that. I'm still saying that mercury is the most important issue to look at, however, not at the cost of overlooking significant other issues that are there as well. Now the last, so prevention. How do you prevent infections? Well, the measles infections are very easy to prevent by not getting vaccinated. Because that's the way the measles virus comes on board. Mumps, in the same way. It seems to be quite different. The defenses that a child has in the mucous membranes, when the measles virus comes in naturally, it comes through the mucous membranes. And the immune system immediately mounts a very effective response.
No matter what age?
We talked about Th1 and Th2. You know, we all have the Th2 prevalent immune system since the vaccinations were invented, and the cellular immunity, the Th1 immunity, is low in most of us. However, if you expose the mucous membranes to measles, the system usually mounts a very strong immunological response. However, if you take the same measles virus and inject it under the skin, bypassing the skin barrier, the immune system no longer mounts an effective response, and the virus now has a chance to grow in you and establish housekeeping inside you. That is the simple, sad truth of it. It matters where you put the vaccine. Most vaccines should not be placed in the blood of the patient, not be injected. They should be exposed to the mucous membranes. With the influenza vaccine, that has caught on now. The most effective vaccine is sprayed in the nose, where the virus naturally attaches to, not injected. Yeah, so there's a little bit of prevention on that end. In terms of preventing Lyme disease, 22% of mosquitoes and stinging flies and lice and fleas carry it in endemic areas other than the ticks. So focusing on preventing a tick bite is ridiculous. You have to basically live in a sealed environment inside a home to prevent it, and it's not a good idea. So currently we don't know how to prevent Lyme disease. We know high doses of garlic protect from it. Good nutrition protect from the easy accumulation of this infection, but we don't really know how to protect from it. Same with the herpes viruses. We know that good nutrition protects from it. Eating non-allergenic foods offers a certain protection. But on this level, and avoiding contact with large groups of people is always a good idea. Avoiding airline flights, bus rides, and so forth. These are all lethal exposures that we're getting. And then the last group of exposures that we have is the xenobiotics and man-made toxins. And here, rather than again pointing the finger at the environmental pollution outside the home, I like to point the finger towards the inside the home, where we have choices. And so the most common exposure that we have to environmental toxins is the carpet and the furniture inside the house. Yeah? Furniture by law in the US needs to be containing PBDEs. They're PBDEs, yeah. They're flame retardants that really evaporate within 6 months of putting them in there. So if you buy a couch full of flame retardants, after 6 months there's no more protection from the flame retardants, but all of them have evaporated and bioaccumulated in the people sitting on the couch. So you're now flame proof, but the couch isn't anymore.
That's probably the goal.
Yeah, since America is the only country with this, there was an interesting study that shows that here in the state of Washington, that the breast milk of breastfeeding moms is so toxic with PBDEs coming out in the breast milk that if EPA standards for disposal would be applied to these women, their breast milk would have to be disposed to with special containers, put on a special garbage dump, because they're so toxic. And this is a very, very sad state. It's very sad. It makes me sad thinking about this.
But it's still the healthiest substance for a newborn and the most toxic at the same time, breast milk. Right?
Yes, and again it's similar with the fish oil, that given and taken, what's available, we know that the formula, baby formula is unacceptable in fluoride levels, because it bioconcentrates fluoride and other things. The breast milk is still, in general, the least toxic substance to the kids, because the formula is so much more toxic than that, even organic. So it's a tragedy. We're in a tragic place of human development with that. It is unlawful for furniture stores to sell furniture without the flame retardants in it. Computers outgas flame retardant have very, very high amounts, and the worst ones are laptop computers, far more toxic than the other computers. And they also evaporate beryllium, which is one of the most toxic metals that come out of laptop. Prevention. Don't use a laptop computer. Get a regular computer with a regular keyboard and put the mainframe computer as far away from you as you can in an area that's well ventilated. I have mine sitting outside the house where it's shielded. My computer box, and I have a long cable running in through the window. And I just have the keyboard inside, and I have the monitor inside, which are the flat screen monitors are fairly untoxic, and the keyboard is non-toxic. So that's prevention on the computer part. Number two, the furniture. Now, there is several non-toxic furniture stores over the internet that people can find. They're extremely expensive. In general, we believe that IKEA furniture is slightly less toxic because they're produced in Sweden. However, they're produced according to American standards. Now we know that they're lowering the amount of flame retardants in there compared to US produced furniture. So keep buying your furniture as IKEA if that's the only one you can afford, but be aware that your couch is probably killing you. And so it'd be nice to get an old couch that's outgassed.
As long as it's not moldy.
Yeah, and ozonate the cushion part as much as you can. But there is, like I said, several outlets in the US that now offer non-toxic furniture over the internet. That's what I did when I had my baby recently. We spent the money on a non-toxic couch, which was a very, very good investment. Carpet floors are an absolute no-no. There is no good carpet floor. Carpet floors are not only toxic, they outgas volatile organic compounds, hundreds of them, which bioaccumulate in a pregnant mom and get immediately transferred into the fetus. But they're also a growth medium for molds, fungi, bacteria, viruses, and so forth that all accumulate in the carpet. And every time you walk on it, a cloud comes up. And when the baby is born, the first thing a baby starts to learn after 6 months or so is crawling around. So the only person in the house exposed to that stuff is the newborn baby. And it bioaccumulates to its closeness to just like your dog. That's why dogs get seizures and cancer, because they're always the ones close to where the highest concentration of these volatile compounds is. So, no carpet floors in the house, have a hardwood floor or linoleum. Don't use a laptop in the home. I could go on for hours, on the other things. Cosmetics that women are wearing are horrible. The makeup contains usually titanium dioxide, which sets up the baby, the unborn baby, for autoimmune diseases.
Because of their allergy to the titanium dioxide.
Yeah, it does something to the immune system that predisposes them to the development of autoimmune diseases. A Czechoslovakian study showed that very strongly.